So dietitians traditionally work in secondary care. That's where we tend to sit, or we'll go into freelance. So primary care is a new career option for us. And those doors have just opened up in the last couple of years with the introduction of the ARS roles, which are Additional Roles Reimbursement Scheme. So obviously the idea of the Additional Roles Reimbursement Scheme was to take the workload off GPs. There aren't enough GPs, and obviously the pressures on the NHS with the amount of numbers that are seeking healthcare are really high. So the idea is what other professions can be drafted in to really take the toll off the GPs. So as part of that work, part of my role was to look at research on how dietitians can work within primary care, in addition to a couple other dietitians across the country as well. The additional roles tend to be going to professions that are well understood. So PCN, so primary care networks, they really understand what a paramedic can do and what appointments they can take off a GP. So the idea is now that dietitians are involved in that, and like I say, I've been involved in the work to see how we can work within primary care, but it's still very much evolving because dietetics is something that's not well understood by GPs and nurses.